Now I'd like to discuss danger signs and symptoms. I'd like you to be aware of these so that as your pregnancy progresses, you keep you and your baby safe, and discuss things with me so that we can figure out if something is becoming abnormal. There are pains that occur while you're pregnant that are normal. Stretching, pulling, heartburn. Always be sure that you share any pain with me and I can reassure you or let you know this is normal or not normal. There's no way to know what is going on with you unless you discuss it. If you have any vaginal bleeding, I want you to evaluate how much. If it's spotting, nothing to worry about. A woman during pregnancy can have spotting for lots of different reasons. Picking up something heavy like a toddler or groceries or laundry. Bearing down to pick up anything that's heavy causes increased pressure on the cervix, and that can cause capillaries to break and then you bleed. But it's just a small amount, sometimes even after sex. So as long as it's a small amount, not a big deal, probably nothing to worry about. But bleeding like a period, I want you to go get your car keys. I don't want you to call anybody. I want you to get in your car and go to the hospital. That's never a good sign. If you develop a fever greater than 100.4 for greater than 2 hours, and then you develop chills, likely indication that you're developing an illness, an infection of some sort, need to go to the hospital. If you have excessive nausea and vomiting causing you to lose weight, that's something I need to know about right away because we can prevent that. We can give you medication so that the kind of nausea that happens where you're not losing weight is normal. But if you're losing weight, that's not normal. So we need to discuss it. If you have any problems with urinating, if it burns, if it feels like you have to go the minute you're done and only a little bit comes out, if there's a foul odor, I need to know. If you have a urinary tract infection, it can cause preterm labor. We can fix that. If your baby doesn't move as much as you're used to, a lot of providers will talk to patients about doing kick counts. I don't recommend kick counts. It's boring, it's time-consuming, and it's not really accurate. What I want you to focus on is how much is normal for this particular baby. Every baby is different in utero as it is when they come out. So develop a sense as your pregnancy progresses. What is normal movement for this baby? If you wake up one day from a nap or in the morning and you think to yourself, oh my goodness, I haven't felt my baby move in over a day. I want you to have a nice big drink of something sweet and cold. Have a snack. Go lay down in a quiet environment on your left side that's dark so there's no other stimulation, and focus absolutely on your baby. It has been determined that at least 50% of the fetal movements after you've been pregnant for a few months are no longer felt because you're used to it. Any leaking from the vagina of fluid that seems to be watery can be evaluated by you as to whether or not your bag of water has broken or whether you're leaking urine. If you have a wet episode and then you dry off and you're dry for several hours after you've cleaned up, and then you have another wet episode, that's not probably your bag of water. That's probably that you are leaking urine. The sphincter that holds urine in your bladder becomes weakened by pregnancy hormones. That leaking can happen when the baby punches you, kicks you, or you bear down to pick up something heavy. Lastly, but not least, if you're swollen in your face, especially around your eyes, in your hands and your feet, and it doesn't go away after you've laid down for about a half an hour with your feet up, somebody needs to check your blood pressure. If you don't want to go to the hospital, seriously, you can go to CVS, any drugstore that has a blood pressure machine, and check your blood pressure. If you're abnormally swollen and your blood pressure is elevated at all, and it's outside of office hours, you need to go to the hospital. Remember, we're just a call away.